The third part of our assessment, sir, will be the assessment of the mouth and oraphics. So in this procedure, I'll be using examination gloves, tongue depressor, and pen light. So this assessment is important in order for us to find out if there are any abnormalities on your mouth and your oropharynx. So this assessment will also give us baseline or initial information about the condition of your oral cavity. So, do you have any questions, sir, before we start on the procedure?
Wala na.
Okay, so, sir, don't hesitate to ask me anything throughout the procedure, the assessment rather. So, sir, to begin with, I am going to ask you some questions regarding your history. So how many times you brush your teeth?
Brushing my teeth ay tatlong beses.
At 3 times.
3
Okay,
times.
sir, that's good. So do you use dental floss or mouthwash po?
Yeah, sometimes it depends or sa ulam ganun.
Okay, kung sa ulam. Siguro masarap lagi ulam yun, no?
Puro nurse, puro karne ganun. Kaya minsan po ano po yung karne sa ngipin ko nagbabara kaya gumagamit po ako ng
Okay. So gumamit ka ng dental floss ha. Huwag mo iiwan sa ano mo. Huwag mo lulunukin yung dental floss, baka lulunukin mo.
ay sige po.
So, do you use medication that is medicated to you po? Okay, so wala po, sir. So, do you wear dentures right now, sir? Okay, no. Okay, sir, so before we move on further, I need you to sit comfortably. So first, sir, I'm going to assess your lips and vocal mucosa. I'm going to inspect the outer lips for symmetry of contour, color, and texture. So when we say symmetry of your contour, it is the ability of the lips to burst. When we say color, sometimes the color of lip is varies to different person. The color of the lips may be indicate health problems such as when it is blackish, it is the result of bad habits like too much cigarette smokes. And when it is pale, it indicates anemia. So when we say texture, the normal textures of lips is smooth and moist. So also, sir, I'm going to inspect and palpate the inner lips and vocal mucosa for color and moisture, texture, and the presence of lesions po. So I am going to use tongue depressor and pen light. So before that, I'm going to wear my gloves on. So just wait me here and I will wear my gloves. So I'm done, sir, wearing my gloves, and now I will inspect and palpate your inner lips. So for vocal mucosa for color, moisture and texture, and if you have a presence of lesions. So sir, can I palpate and also inspect your lips? Okay, sir. Then, can you please purse your lips as if you're going to whistle? Okay. So, since as I observe, sir, your color of lips is like pinkish and it is normal, and your the moisture of your lips and texture is smooth and moist, and and you don't have any presence of lesions po. So Next, I'm going to examine the teeth and gums. So I will inspect your teeth and gums while examining the inner lips and vocal mucosa. Okay, sir. So can you please open your mouth? Okay. As I examine, sir, your teeth and gums, your teeth is your present teeth is 32, and that is normal count of the teeth, and your gums is pinkish, so you don't have any presence of edema, refractions, and presence of lesions din po. So next, sir, is so, and I also inspect if you have a dentures, and so since you don't have dentures, it is okay. So next, I'm going to assess your tongue and floor of the mouth and inspect the surface of your tongue for position, color, texture, and I want you, sir, to protrude your lips. So can you please open your mouth, sir? So your color of tongue and the texture, your tongue is color pink and the texture is normal. So we're going to inspect the movement of your tongue, and can you please open your tongue and roll it? Can you please open your mouth and roll your tongue? Roll your tongue upward and side by side. Okay. So next, I will inspect the mouth floor and the frenulum. So can you please put your tips again to the roof of your mouth, use your open, and then your tongue, lift it up. Then, so next I'm going to assess the palates and uvula. I am going to inspect hard and soft palate for color, shape, texture, and the presence of bony prominences. Can you please open your mouth wide and tilt your head backward? So, and lastly, sir, I'm going to assess your oropharynx and tonsils. So I inspect your oropharynx for color and texture, and I inspect one side at a time to avoid eliciting the gag response. To expose one side of the oropharynx, press tongue depressor again to the tongue on the same side about halfway back while client tilts the head back and open the mouth wide. So I will use a pen light for illumination. If so, please, sir, can you open your mouth? Okay. So sir, I already inspect your tonsils, and after examining your mouth, the color and the texture of your mouth, all are normal, and we don't have any abnormalities in mouth. So that's all good, sir. And now I will remove my gloves and perform a hand hygiene to eliminate bacteria. So that's all for assessment, sir. So I am going to document the findings now and record it. So upon checking your assessment, sir, there is no presence of abnormalities in your mouth and referee. So thank you for cooperating. Have a nice day.
Thank you.